Good afternoon. So welcome back to my channel. For those of you that already know me, welcome back to my channel. For those of you that do not know me, so my name is Virgilia Abad, and I'm a cancer survivor. I survived to triple negative breast cancer, stage 2, going into 3. And so I already completed all of my chemotherapy treatment, radiation, immunotherapy, and at this point I'm on the reconstruction surgery. So I will ask you, please, if you are so kind, and if you could join my channel, so please subscribe, and so please give me a thumbs up, and so leave your comment below. So I suggest, before I even started this story, stay to the end, because you want to get the full message, so that I'm going to transmit in this conversation. So I'm going to be talking about my reconstruction surgeries, so I'm on the reconstruction surgery. So in 2021, December 2021, so I have my first surgery. So that was the double mastectomy. So I got the two breasts removed, and also in the same day, I also started my first reconstruction surgery. So the first 4 hours, they were done by a general surgeon that was specialized on breast. And so what he did, he removed the two breasts, and also from my right side, he also removed the 11 lymphatic nodes, so why he removed those lymphatic nodes is because these lymphatic nodes, he wanted to find out if there was any spreading of the cancer in other part of my body. So in fact, there was one of the lymphatic nodes that he removed that was like right here. They called the extraclavicular nodes, that was 1 centimeter away of getting infected. So it means it was really dangerous. That was one of the reasons why the doctors recommended, even though I didn't have a spreading of anything whatsoever, but because the cancer was too close, 1 centimeter from the extraclavicular nodes, and that node cannot be removed. That comes straight from the brain. So then it was a danger in there, because that cancer could have traveled to my brain, and for God's sake, I might not even be talking to you at this point. So, but thanks God didn't happen. So anyway, at this point now, I do have like 9 surgeries, and the very first surgeries, like I mentioned, I have half of the section was the general surgery for the 2 breasts removed, and the second part was my first reconstruction surgery, which is the point that I want to talk about. So about a month later of having the first reconstruction surgery, I presented an infection on my right side. It was actually my breast getting like really red. I did not know what it was, but I feel like myself warms, and I feel like a little bit chills and things like that. As soon as I noticed that, I notified my plastic surgeon, and so he proceeded to give me some antibiotics. Another thing is, I remember it was about 3,000 milligrams of antibiotic. That's pretty high, because I was in transition to get like chemotherapy and immunotherapy, and to start those treatments, I needed to be totally clear of infection. So then within that time as well, the doctor, I remember, so I used to visit him like once a week. So every time I will go to the doctor's office, the plastic surgeon, so what he was doing, so in the major surgery, in the first surgery, so he put on like expanders, like these are like a gloves, and those expanders, so he started like filling them up during the recovery time, so like, so I got my surgery in December. Then in January, he started refilling those gloves, those, so silicone expanders. So he will put in there some kind of saline water, and that saline water, so he give the volume desire to preserve the space and to continue expanding the muscles, since I got all of these muscles and most of the skin removed from my chest, my breast. So now, so there was a transition, like, so from February 2022 to November 2022, there was kind of like a break between, the plastic surgeon and procedures with me. So why? Because I was going to be getting, chemotherapy, immunotherapy, and I also was going to be getting radiation, so let me tell you, so a plastic surgery, when it comes to reconstruction after cancer, is not considered just an aesthetic procedure. No, it's something else. So if you notice, most of the patients that they go for like breast augmentation, or they want to do other kind of procedure with the breast or reduction and things like that, they probably just do it in one day. When it comes to cancer, so there's a lot of procedures involved. And in fact, the doctor have to be easy, because the fat grafting, so they usually take like 1,000 cc at a time. And from that 1,000 cc, the doctor take a very little fat, maybe like 50 milliliters, maybe 100, I don't know, the doctors will know. And that's what they injected in there. So not to mention the situation that, so, and the place that is radiated, all of that skin, all of these muscles, they become hard, so they get practically damaged, and it makes it very challenge for the reconstruction surgery. So anyways, one day, my oncologist, she was telling me, oh, when you finish up your chemotherapy treatment, so if you want, you can do your reconstruction surgery and finish your breast, and then you could do your, radiology. And I was like, that doesn't sound to me. So I do have an excellent, relationship with my plastic surgeon. So what I did, I called the plastic surgeon because it did not sound to me. And I asked the question, and then my surgeon say definitely no, 100% no, which I'm glad. So anyway, so it was about 11 months, and I finished up, so my all of my treatment, chemotherapy, radiation, immunotherapy. So then they proceeded to remove the port, so in my heart, so from that 9 surgery that I mentioned, 2 of them was to put the port and to take the port out as well. So now, so I started officially the second reconstruction surgery on November 2022. That's where my plastic surgeon, he proceeded to remove the expanders, from my breast. It is very, very extremely important that those expanders, they get removed on time, so because if they don't get removed in time, according to my plastic surgeon, they could create fibrosis. And in some cases that, there have been people that they even have all the tumors and things like that. But I'm very, very glad, very happy that I'm a person that like to do research. I'm very well informed. I'm always investigating because it's my body, so it's talking about my body, my life. And I was reading about that, and those expanders, they cannot be left in the body more than certain times. In fact, I was reading 4 to 6 months and max about 9 months, okay? So I'm very happy. I have some issue, in between, because my oncologist, she didn't want my plastic surgeon to do his job. but I'm not an easy person, so I made sure that I speak very clearly to my oncologist, and she didn't have nothing but just to go ahead and give the green light to do what I had to do. Because, so I am my own advocate. I need to speak out for myself, and I need to care about myself. And the one that is making my surgery is my plastic surgeon, and he is the one that knows the procedure. So now the job with the oncologist was already completed. So then I proceeded with my plastic surgeon. So saying that, so next thing is I go for my first surgery. I get my my expander removed. Oh my gosh, I was so free. When he removed those expanders, I feel kind of free. But he installed in there some kind of small implant. He actually called it like tacos or package and things that I can think about the Mexican food, which is delicious. And so these are with the so these are like temporary as well. And so what it does, it helps to for the fat grafting and keep the shape and the envelope secure, because fat doesn't have no forms, so it's liquid, so every surgery, every plastic surgery that I have gone, it have been outpatient, so outpatient means I go in the morning, and so the surgery usually take between 2.5, 3 hours. So then I get a recovery time, maybe like 2 hours or maybe more, I don't know. The thing is that they release me and I come back home with instruction and all of the procedures, everything that I'm supposed to get on. And of course, I do the follow-up, so far so good. Everything have been going good, so until this point. But I have to tell you that reconstruction surgery is not easy. It is painful. It's a long process, but it's a secure process as well. Because in my case, being 63 years old, I don't see myself, and I didn't see myself back then doing procedures after I'm 70, if I get to reach there, okay? So because all of these procedures, like if you get implant, you have to do revision, you have to take it out again and put it back, and not to mention if you start getting like implant illness or other discomfort, I don't know. So anyways, I decided to do what I thought that it was better for me. So I decided to do the fat grafting, and I trusted my plastic surgeon, which is an expert on what he does, and I started doing that. So one of the things that I noticed with the fat grafting, with the reconstruction surgery, is the so you could get infection. There is anything that could happen, so because a surgery, it has some risk always, so but I did get infection. At least 3 surgeries. I got 2 of them. So then I got like abscess, especially on the side where the cancer was, and the same side where the radiation was. And it's very hard, it's very difficult, so because that skin, it kind of get damaged, and the muscles, it get hard, and it's very challenge, very challenge for the doctor, very challenge for me. But thanks God, so because I'm always observing my own body and checking what is going on, what is happening with me, I was always to be able to inform my doctor on time, and he was able to take care of, that situation, which is wonderful. Anyway, so I thought about sharing this information with you because some of you might decided to do the fat grafting, some of you might decided to do the implant, or you might have some family member, somebody might decided to do the being flat, so in my case, being flat 100%, it was not going to be an option, because that for me, my breast is not just aesthetic. It was not just the purpose of feeding my children, but I also feel that these breasts, they cover up my chest, they covered up some organs in there. It gave me kind of balance. Even when I was going like in front of my stove after I have the surgery, the beginning, I feel like the heat coming in, and so sometimes when this was cold, I feel that, and I feel a lot of pain, from time to times and things like that. But I realized that I was not a person to be flat, okay? And I'm glad that I decided, so to be that way. So anyway, so I'm still dealing with my reconstruction surgery, and I'm very happy that I'm doing so. I know one thing, that soon this process is going to be over. So it's not easy to be a cancer patient, even a cancer survivor, I would say so, because we live one day at a time. So far, I didn't have any other major problem, but I have to keep an eye on me, okay? So anyways, I hope that someone can get help, so with my story today. And I hope that, so if you go into the process, just put a lot of faith on God, so I myself, I don't know how to live without God. So he's like my helper at every single minute, because it's painful. It's a long process. But in the meantime, I feel like it's more secure. I feel more safe, by doing it the way I do. Anyway, so please don't forget to subscribe to my channel, give it likes, and please leave your comment below. So please check on other videos that I have. Also share with other people, so we might be helping somebody by doing so. And I will see you next time.